doctors, a very warm welcome to all the doctors present here on behalf of the whole Himalaya family. Thank you so much for coming here, sparing your valuable time, and being here with us. So, of course, while inviting you guys, our colleagues would have mentioned the purpose of today's meet. Basically, we are here to join for a symposium. Basically, Himalaya is conducted one of the biggest clinical trials ever done by a herbal company on a hepatoprotective drug, and that is where we today stand to discuss one of the robust studies with global international standards. Before moving on to the session, a brief introduction of what Himalaya has achieved in last recent years. So right now, Himalaya is positioned on 24th rank in the whole Indian pharmaceutical market. We are the only herbal brand to be positioned in top 25 across the whole Indian pharmaceutical market. So that's a huge deal for the company. As well as if we look at the fraternity, it's a huge achievement for the whole Ayurvedic fraternity that a company from our background is right now leading India's pharmaceutical market. Apart from that, the drug that we are going to discuss today, the diseases and the whole basket of Lift-2 DS, drops, tablets, syrups all together is right now positioned at third rank in the top 10 brands across the whole Indian pharmaceutical market. If we talk about Indian pharma market, it contains more than 55,000 brands. Out of that, being in top 10 and that too on third rank, it's a huge deal for the company as well as a huge achievement for the whole fraternity that a drug from our background is right now leading brand across India. If you just simplify this, अगर आज कोई भी डॉक्टर हेपेटोप्रोटेक्टिव ड्रग लिखता है तो Lift-2 is the first brand that he is prescribing across India. So that is a huge achievement for the company, and we thank you all the doctors who are present here and Pan India who have supported us in reaching this milestone. Coming to today's session, we have two prominent speakers. Dr. Kochar sir, he would be enlightening us with his expertise on the disease aspect. And then we have Dr. Sachin sir. He is one of the principal investigator of the study that I was discussing earlier. So he would be enlightening us with the whole study, the results, and how the studies were conducted and everything. So moving forward, Dr. Kochar sir, he is a distinguished Ayurvedic physician with an MD in Ayurveda and an clinical experience of more than 30 years. He is widely recognized for his expertise in the management of chronic as well as autoimmune conditions, as well as on the approach of integrative cancer care. Dr. Kochar has held honorary consultant positions at several institutes, including KEM Hospitals, Tata Memorial Hospitals, and University of Mumbai, and currently he is associated with Mithil College. His contribution to clinical research, particularly in the evaluation of Ayurvedic formulations such as curcumin, ashwagandha, cannabis in oncology, has been a notable significance. Currently serving as the president of Goregaon Medical Association, Dr. Kochar is also actively engaged in the research and development of standardized, evidence-based Ayurvedic formulations aimed at improving patient outcomes and quality of life. It's an honor to welcome you, sir, for today's session. Please enlighten us, sir. Thank you.
Thanks a lot. We should give, first of all, big round of applause to our Dr. Nilesh sir, who has represented India in USA. You know, he has presented number of cases on efficacy of Kshara Karma and Kshar Sutra in piles. Great job, sir. And he is always a great inspiration for all of us. And thanks for the nice introduction. And we start here. Small correction. I was the president for 2 years of Goregaon Medical Association. Now my term is over. I'm free now. I'm a past president. Yeah. Okay. Thank you. So, we all know about him, at least my generation, our generation, a great scientist who served nation, who brought India's name on the horizon of, astronomy, not the astrology. He just day before yesterday, he passed away. And he is the one, he worked on astrophysics. He worked on what we call black hole, Krishna Weaver. And he popularized, he proved the theory that the time freezes in this black hole. He brought all those things and he explained the difficult and most what we call Kitskut language of astronomy in a simplest Marathi language and spread the knowledge of astronomy. So in his words, since science popularization involves information about science, explaining the things and their implication in detail. So why I am quoting his term, as Dr. Modi said, that what we require today is evidence-based science. We all believe in Aptopadesh. We all respect Aptopadesh. But प्रत्यक्ष प्रमाण ही श्रेष्ठम. हमारे खुद के आचार्यों ने ये कहा है. तो what is the प्रत्यक्ष ज्ञान? You are able to prove it on laboratory, clinical and your personal experiences. And we must, thank Himalaya for doing such a huge trial, 1,000 patient multi-centric trial. And that proves really the efficacy of a herb which you and me can definitely write with more confidence. So that's why I have quoted Dr. Jayanta Naralekar sir quotation, and I pay my sincere tribute to this wizard personality. My sincere gratitude to all my teachers, Dr. late Vaidya Shri Lataji, Vaidya Shri Gopal, Shri Gorodia sir. Those who are from Mittal Hospital, they all will know this. Vaidya H.P. Sharma ji, Vaidya Rakesh Sharma, Vaidya Ranawat, Dr. Ashish Vishwajit, my friend, Nitin Gorodia, Hina, my association member, and I am lucky enough to work with a lot of modern doctors like Dr. Devchand Gala. He is my guru. He is MBBS and doing pure Ayurveda practice. Dr. Ashok Vaidya, late Dr. Ashok Vaidya. He is a pioneer of, one of the pioneers of clinical pharmacology. Dr. Nilima Kshirsagar, Dean of KEM Hospital, Nirmala Rege, Dr. Banavali from Tata Hospital, Dr. Manish Agarwal, with whom I worked in Tata Hospital in 2005-06 on osteosarcoma to establish the efficacy and safety of ashwagandha and curcumin. Dr. Pankaj Chaturvedi, Dr. Badve sir, he is a dean with whom I have recently completed my trial on efficacy and safety of cannabis. Dr. Vikram Gota, with whom we have worked on ashwagandha. Dr. Shalaka Joshi, again I worked with on cannabis. Dr. Manu Lopas, with whom we have worked on gold nanoparticle on efficacy of cancer. And Dr. Mitali Mukherjee, she is a geneticist, and we are planning to work on Ayur genomics. Okay, so Vat Pitta Kapha to prove in genomics way. And believe me friends, she has proven, जो वात के 80 विकार, पित्त के 40 विकार और कफ के 20 विकार, she has proven exactly the same number on genetics. Not a single number less and not a single number more. I know, sir, you are listening to me and you may call her in our next APCON. Thank you. And Dr. Sayyid Tahir, he trained me on cannabis. So these are all my teachers because of whom I am standing here. So if you like my presentation, the credit goes to this. If there are any shortcomings, that is definitely upon me. So how many of you remember this movie? Practically everyone. Our age, everyone. So some movies are, milestone. Diwar and Sholay. They represent that era. The dialogues, मेरे पास माँ है, गब्बर, मैंने नमक खाया, तू गोली खाया, all those things we remember. Why I am showing this slide is, India at that time was different. We all were suffering from infectious diseases. People were dying of infectious diseases, right? All cholera and all other infectious plague, and so you call, and all other infectious diseases were present at that time. Typhoid, malaria, everything. Now India has changed. We all have witnessed this changing India recently post Pahalgam attack. I am not talking about that, but even in the field of medicine, what we are suffering, what doctors, family physicians are seeing, the surge of patients of non-communicable diseases like diabetes, like heart attacks, like cancer, stroke. All these diseases are on rise. And we family physician must update ourselves, with these non-communicable diseases. You will be surprised to know that there are more deaths due to non-communicable diseases than due to the infectious diseases. Okay? So, what we are going to discuss about today is one such non-communicable disease, that is, the chronic liver disease. Okay? 2 million deaths annually with this, and responsible for 4% of all the deaths. Due to cancer, we know that 1500 patients die per day. Number of liver diseases death is much less, but if we do not treat them properly, definitely this number is going to rise. So chronic liver disease affects more than 800 million individuals globally. If I talk about India, almost we have 18% of the global load of chronic liver disease. So it's a time that we all should wake up and should try to diagnose chronic liver disease and all other liver disease as early as possible and treat them effectively with evidence-based formulations and medicine. So, hepatic epidemiology of the liver diseases. So, this is something what we used to call chronic. This is called what we used to call that non-fatty liver, non-alcoholic liver disease is now called metabolic associated liver disease. So, these are all percentage of patients those are having these diseases. If you can see this, okay. So, alcoholic liver diseases because of the hepatitis C, hepatitis B, these are the percentages patients are suffering. Every patient comes with different diagnosis, signs and symptoms, and we should be able to pick them up and treat them effectively. So, the names are like alcohol associated liver diseases, metabolic dysfunction associated steatotic liver disease, viral hepatitis, and most important, drug-induced liver injury. Even single paracetamol is now proven can cause, the liver disease, which we all wrote left, right, center during the COVID, and we are writing, but we should be very careful. And another thing which I have added from my end, and we all Ayurveda doctors are, said that your herbs are injurious. So this is called Hilly. Dilly is drug-induced liver injury, and now this is another one, herb-induced liver injury. There is a general conception that Ayurveda drugs are safe. Yes, they are safe if they are prepared as per the text and as per the method written in Ayurveda. Many of my allopathic doctors, they have misbelief that Ayurveda does not have concept of drug safety and Ayurveda does not have treatment protocol. So this slide is for them. You see, na nama matrena rupa matrena va punah aushadhinam para prapti kaschid veditumati. Charak Samhita first adhyay. It's a pharmacognosy. One should not use the drug if you do not know the name, if you do not know the pharmacognosy. In second line, Charaka says, aushadham yah anabhidnyam. Nama rupa gunahi tribihi vidnyatam chapi duryuktam anarthayo upapadyate. Even though you know name, even though you are able to know the pharmacognosy, but if you do not know the qualities, properties, efficacy, then also that herb can cause side effects. So what is yukti purvak upayog, and what more can be better than if you have a trial of 1000 plus patient, multi-centric, okay, whatever, open arm, single arm, blind, double blind, whatever, but this gives you confidence that you know about the herb or a formulation by name, you also know pharmacognosy, and you also know when to use and when not to use. Ayurveda has clearly written, if you use drug without any judicious application, it will cause side effects like yatha visham, yatha shastram, yatha agni, ashani yatha. Aushadham ya anabhidnyam vidnyatam amrutam tatha. So poisonous side effects like anaphylactic side effect. Okay, yatha visham, yatha shastram, catalytic side effect, agni. Herb can burn the GI tract or any other organ. Okay, and ashani, like electrocution. So these are the all side effects which are mentioned. And the protocol about treatment, if I say, tadeva yuktam bhaishajam yad arogyaya kalpate. Use the medicine which is appropriate for that person. Prayogah shamayad vyadhim anyam udaryet naso vishuddha shuddhastayu shamayad nacha prakopayat. So the clear protocol, you should use a herb which will not cause side effect and which will improve patient's quality and quality of life and will reduce the disease. So these are the clear-cut protocols are mentioned in Ayurveda. Effects and side effects are very clearly mentioned. So we are well aware of herbal induced liver injury or side effects of the drug, and we all know the protocol how to use the herb. Okay? So before the conversation I said yes, we are open to criticism, but it should be healthy criticism. Let me be very honest and upfront. There are some doctors, hepatologist, Dr. Abby Kirsiriak, you all know his name. He has criticized Ayurveda. I welcome his criticism if it would have been some respect. He has denigrated Ayurveda without any, having support. I fought with the Times of India and everything, but I am shot in front of all pharma companies. So I have sent him all these things. So herbs which are used, Liu 52 is the multicentric trial has been done, and he was criticizing this drug. I don't belong to this company, but still I felt that because of the belonging to Ayurveda community, I fought and I tried to prove that these herbs are very safe and multiple trials are done. So let us move ahead. Alcohol associated liver disease. My all friends, please don't take me wrong. Alcohol is not bad if it is taken in a moderation, but if it is taken in a large quantity, yes, it is definitely bad for the health. So what is harmful drinking? According to the science, even single drop of alcohol is bad. But they say that more than 3 drinks per day or more than 21 drinks per week for men and 2 drinks per day or 14 per week for female is not good. Again, it all depends upon the age and the other comorbidities. If person is having blood pressure, diabetes and existing liver disease, so of course this is not the gold standard that person can have 3 pegs or 21 pegs per day. No. So one has to be very cautious about drinking, and during drinking, many a time people tend to eat a lot of oily fried stuff. That is worst because that gives more load on the liver. So that is to be avoided. Even if you are drinking, please have salads and fruits. They are the best, and try to avoid all fried foods. So alcohol liver disease, this is patients alcohol dependence with evidence of alcohol associated liver disease, alcoholic hepatitis. So you have to do for the score. If the score is less than 32, you can do conservative treatment, you can maintain, and this will be your main chunk of the patient to whom you can write the drugs, proven drug, and take the advantage and can prevent them for the damage. If already severe alcoholic hepatitis has been set and the score is more than 32, then you need a pharmacotherapy based intervention in that, and further management should include a potential liver transplantation if there is a liver failure. So what is the global prevalence of non-alcoholic fatty liver now, which is called metabolic associated steatohepatitis liver disease? Okay. So why it is the steatohepatitis? Steto means there is a accumulation of the fat and there is an inflammation. So that's why it is called MASLD. There is an inflammation in the liver because of the accumulation of the fat. So general population, 1 out of every 4 means almost 25%. So in this auditorium, almost I can say that 25% of the people, they may have fatty liver disease or they may have what we call metabolic associated liver disease. So if you start taking some good drug, if you start changing your lifestyle, regular exercise, regular diet, proper sleep, that will prevent from the further damage. When patients are diabetic, so more than half, almost 57% of the diabetics, it is incident they have that metabolic associated steatohepatitis liver hepatitis. Morbidly obese patient, they will almost 95% of the patient will be having this fatty liver disease. and prevalence in Asia is more, 27%, and prevalence in India is around 9 to 32%. Why prevalence is more in India and Asia? That is because of our mitochondrial dysfunction. We all Indians have, what we call maladapted mitochondria. That is my core topic of research. This dysfunctional mitochondria, because of which there is no thermogenesis. We Indians are lacking one gene called uncoupling protein. It is not there in our mitochondrial respiratory chain, or it is in a less amount. That's why intracellular thermogenesis is not there, which causes accumulation of the fat, lipid inside the cell. And that is the root cause of insulin resistance. So we Indians are prone to develop diabetes, especially type 2 diabetes, and also fatty liver disease. And this mitochondria has got a clear-cut connection with our Agni. Like Artavam Agnayam, what we say, Agni kahan se aata hai aapko? Aapke maa ke paas se aata hai. Mitochondria is transmitted through mother. Sperms do not have mitochondria. Mitochondria are there in the sperm neck, but not in the head, which ovulates, okay, to the ovum. So we receive mitochondria, we receive Agni from mother. If you treat mitochondria, if you treat Agni ke principle, say all symptoms, will improve. Okay. So we will talk about on that mitochondria and Agni on some other day. So why we have more amount of fatty liver disease and type 2 diabetes and dyslipidemia? The root cause is dysfunctional mitochondria. Now, India is the second highest number of obese children. This is the recent data. Almost 14 million Indian kids are obese. And especially from 1990 to 2022, there is a sudden rise of, this kind of obese kid. That is mainly because of the changing habits. In our childhood days, we never used to get all kinds of wafers or cakes and pastries. Occasionally, we used to eat. But now it is available at the blink of your movement. Okay, you just call, someone will come, drop, and so that is the main root cause of, the obesity is increasing. They are more gauged to the gadgets, they don't play, and that's why the Indian kids are growing obese and obese. So, 14% of the youth use tobacco, and per capita consumption of alcohol has also been increased in India. Especially in the olden days, before 90s, the alcohol consumption was related to the higher income group. Now it has percolated, and even lower income group people are also drinking more and more alcohol. And we are, we were very happy when Indian government reduced the tax on the foreign liquor. In Corona, we all know that, the alcohol shops were open first in order to generate the revenue. So that is the thing. So alcohol consumption in India is a rising burden. You can see from the numbers, from the graph, from 1990 to 2021 or 16, that is so much of increase in the alcohol consumption. The same thing is written in Ayurveda also, in Santarpan Janya Vikar. Ati Sampurnam Medyanam cha Ati Bhakshanam Varunyascha Ati Sevanat. So this alcohol is excess. Use word Ati Sevanat. So in moderation one can have. Anyone recollect the shlok on alcohol in Ayurveda? There is a good shlok. Those who drink, they will like this shlok. Hey, hand mic hai kya? So what Ayurveda says, hand mic then. So Ayurveda says, Anala uttejanam rucham shoka shrama haram param na cha asti anyam bala vivardhanam dvitri chashakam sanmanyo iti janaha. Means अनल उत्तेजनम, जिससे भूख अच्छी लगती है, रुच्यम आपकी रुचि बढ़ती है, शोक श्रम परहरम जो आपका स्ट्रेस फटीग सब निकाल देता है, आयुष्य बल विवर्धनम आपका लाइफ और बल योर स्ट्रेंथ बढ़ाने के लिए अल्कोहल जैसी अच्छी चीज नहीं है. आई एम वेरी हैप्पी ऑल आर हैप्पी. श्लोक रिटन इन चरका. ओके, सो लेकिन एक टैग है, एक कैच है. कितना लिखा है? द्वित्री चषकम, 2 या 3 पेग. So when I read this, the chashak kalpana, the peg kalpana is so long. Charak Samhita was written 3000 years before or at least from 3000 years from now. So peg kalpana जो है, चषक 2 या 3, बस उतना ही पीना है. उससे ऊपर अगर आपने पिया तो आपका
अपमान होगा, सम्मान्य इति जना, 2 से 3 पेग पियोगे तो चलेगा. It doesn't mean that I am giving you permission to drink alcohol. Okay. Now this is sugar. How much sugar we eat every day? Almost 10 spoon per day, which is high number, very high number. That is bad. And this increasing sugar consumption is also causing obesity. You know, दारू के खराब के बारे में मैंने बहुत बोला, एक शेर है, मुझे जस्ट याद आया कि दारू या शराब तो नाम से ही बदनाम है. शराब तो नाम से ही बदनाम है. जरा नजरें इधर उधर उठा के देखिए, शक्कर और नमक से मरने वालों की तादाद बहुत ज्यादा है. बराबर. So 19 kg per year or 10 spoon per day, that is a high intake of sugar we are having, and that is equally cause of fatty liver disease. So one should avoid that. This is the obesity rate, what we said. 26 million Indians are obese, 44 million females are obese. We have realized that, and we are thankful to our Honorable Prime Minister. In his one of the speeches in the month of March or April, he requested all at least reduce your oil intake by 10%. He has initiated so many programs. He is encouraging kids to play more and more. So Fit India is a concept of our Honorable Prime Minister Narendra Modi ji. So विकसित भारत तभी होगा जब आप फिट है, शारीरिक दृष्टि आप तंदुरुस्त है. तो ऑयल कंजम्पशन कम करिए, शुगर कंजम्पशन कम करिए और अल्कोहल कंजम्पशन को एकदम कम कर दो. अगर ये हम कर सकें तो फैटी लिवर क्या, बाकी डायबिटीज, ब्लड प्रेशर, ये भी सब कम हो जाएगा. So this is about metabolic associated fatty liver disease spectrum. So these are all healthy organs. Pink of your health, liver, which gives energy to all the organs, vital organs. Metabolically healthy person. But when the fat gets accumulated here, the liver is not able to work properly, will not be able to give energy. So if somebody comes to you with the symptom of fatigue, it may not be always because of B12 and D3 deficiency or calcium deficiency. It could be because of the fatty liver. Person apparently may look normal to weight, to height and to his age, but just do a sonography and rule out if there is a fatty liver. That could be one of the causes. Because in that fatty liver, brain is not able to get proper sugar and energy. चलने पे थकान लगती है, may not be always because of the heart, it could be also because of the fatty liver. So try to find out the diet, क्या ले रहे हैं, exercise pattern, and do simple sonography, fibroscan, you will come to know about the liver status. Okay? So this is hepatic and extrahepatic effects of metabolic associated steatohepatitis. So all fat accumulated on the heart, on the liver mainly, and this fat is inflammatory fat. This is the cause of even many allergic. So many patients of allergic rhinitis, sneezing, asthma, they respond well if you treat simple by Triphala Gugul. We all treat by Naradiya Lakshmi Vilas or Tribhuvan Kirti. Try to use Triphala Gugul. संतर्पणजन्य जो चरक संहिता में अध्याय लिखा है उसमें मुस्तादी काढ़ा लिखा है. सो मुस्तादी काढ़े की टैबलेट भी अवेलेबल है. आप मुस्तादी काढ़ा यूज करके देखिए. ओके. इनफर्टिलिटी, उसमें लगभग 14 या 15 वनस्पति है, बट दे आर सो यूजफुल. उसके इंडिकेशन अगर आप देखेंगे मुस्तादी काढ़ा, इंद्रियम स्त्रोतसाम लेपो, नथिंग बट एथेरोस्क्लेरोसिस, बुद्धिर्मोह प्रमीलकः, नथिंग बट द डिमेंशिया, अल्जाइमर. These are all the outcome of your fatty liver disease and the overweight and excess fat. So change little concept, think from that point of view, revisit the grantha and read the indication. Okay, you will find many solutions to it. Even chronic kidney disease is also outcome of fatty liver disease. So Varunadi Kada use kar sakte hain, which works on kidney also and reduces fat also. So as I said, mitochondrial dysfunction causes reduced thermogenesis. The fat is accumulated in the cell. Now the same fat will get accumulated in two areas. One, subcutaneous. If you take a person of my height, my age, my weight, European person, he will be exactly same, but he will be healthier. My height is 177, my weight is 77 kilos, my waist is absolutely perfect, but still there is some fat. And still my muscle is not that strong as European person. European person, they have more of subcutaneous fat. उनके मनगट हाथ मोटे हैं, पेट कम है, muscles ज़्यादा, because they have more brown fat. We Indians do not have brown fat. Brown fat is rich with mitochondria. It burns the fat. Thermogenesis is more. Okay? So, subcutaneous fat में जब तक fat है तब तक तो you are happy. But moment that fat gets accumulated in your peritoneum, on your viscera like liver, muscles and your heart, that is bad. So, हर एक का सबक्यूटेनियस फैट का कैपेसिटी कम है, ज़्यादा भी हो सकता है. वो कैपेसिटी खत्म हो गया तो आपका फैट यहाँ पे आना शुरू होगा, पेट पे आना शुरू होगा. एंड दिस फैट, दिस टिश्यू, विसरल फैट इज इन्फ्लेमेटरी. It is the root cause of allergy, inflammation, even malignancy. So as I am doing research on malignancy, alcohol, yes, alcohol is the cause, but 35% of the malignancy is because of the obesity. The breast cancer and ovarian cancer, these are the data from the PubMed Index journals. So obesity is the root cause of many diseases. Okay, not only the fatty liver, but the many diseases. We must try to treat that. So again, this metabolic associated fatty liver, these people are prone to diabetes, blood pressure, as I said, policy, PCOD. Almost 1 in 3 girls is now having PCOD. When we were studying, 1 in 5 or 1 in 7 girl was having PCOD. Now that number has increased like anything. Sleep apnea, so many patients, sir, thakan lagti hai. BP is not coming under control, sugar is not coming under control. Ask only one question to his or her wife or husband, does she snore or does he snore? The answer will come promptly, yes, he snores a lot. Do the sleep apnea study and it will prove. Today I had a patient, his weight was 140 kg. And I asked only one thing, सुबह कैसे उठते हो? अरे बहुत थकान लगती है, जल्दी और सोने का इच्छा होता है. रात को नींद, immediately wife said, sir, બહુ ઘોરે છે, નસકોરા મારે છે. ગુજરાતીમાં નસકોરા ને snoring. So that subjected him to the sleep apnea study. If you do not reduce that sleep apnea, weight will not reduce, BP will not reduce. So these are the opportunities, where you can pick up the diagnosis. Somebody coming to you with the fatigue, look for the fatty liver, look for the sleep apnea. Not always, yes, B12, hemoglobin, D3, these are the conventional causes, but these are the extra causes which you should remember. Sugar is not coming under control, probably sleep apnea and MFLD could be the cause. Breast cancer, prostate cancer, colorectal, they all are increased when patient is having this metabolic syndrome. So etiology of hepatitis C. These are all data, hepatocellular carcinoma because of the hepatitis B and hepatitis C. These are all normal, alcohol, and you can see this non-alcoholic fatty liver disease. So 927, I don't remember the number kya hai, but these are the almost percentage. 35% of the people with non-alcoholic fatty liver disease will have hepatocellular carcinoma. So obesity and fatty liver diseases are the important causes of cancer also. So non-alcoholic steatohepatitis and alcoholic steatohepatitis. Okay, this was the study. Am I supposed to continue this or you are going to take it? No. Okay. So obesity, diabetes 25%, fatty liver and alcohol more than 30 grams per day. So these are the percentages of the patient who are seen, and in 1,000 patients. So cirrhosis will be seen in 10% and liver cancer, and cirrhosis will be seen in 3 to 5% and liver cancer will be seen in 3 to 5% of the patient. Okay, those who are having alcoholic steatohepatitis, and non-alcoholic steatohepatitis is more dangerous. Available treatment for non-pharmacological treatment like dietary intervention, most important. Another reason for increasing this, now many patients come to us, sir, हम तो दारू पीते नहीं हैं, हम सिगरेट पीते नहीं हैं, फिर भी क्यों हो रहा है? But if you take the history, many Jain patients or many vegetarian patients, in order to have more and more protein, they consume milk, they consume paneer. बहुत ज़्यादा मात्रा में पनीर का कंजम्पशन बढ़ गया. आई एम नॉट टॉकिंग अबाउट द एनालॉग पनीर विच वी गेट इन द मार्केट, लेकिन एक्सेस पनीर, एक्सेस प्रोटीन. ये स्टोरी ऐसा है, बीटा कैरोटीन इज गुड फॉर आईज. ओके, तो गाजर अच्छा है, लेकिन फार्मा कंपनी को कुछ यूज नहीं है. तो व्हाट फार्मा कंपनी सेट, इफ यू डोंट कंज्यूम बीटा कैरोटीन आप अंधे हो जाओगे. सो बीटा कैरोटीन का सेल बढ़ गया. द सेम इज प्रोटीन, अगर आप नहीं खाओगे तो आप बहुत कमजोर हो जाओगे, ऐसा हो जाएगा, आपके सब मसल्स कमजोर हो जाएंगे, आपको तकलीफ हो जाएगी. और प्रोटीन इंटेक बढ़ाने के लिए वेजिटेरियन लोगों के पास, हमारे पास में एक ही सोल्यूशन है, वो है मिल्क. नाउ आई ऑलवेज हैव अ फाइट कि क्या आयुर्वेद में दूध लिखा है पीना चाहिए या नहीं. लेट अस हैव अ हेल्दी कम्युनिकेशन, हेल्दी डिस्कशन. व्हाट डू यू फील, कम ऑन. दूध क्या लिखा है आयुर्वेद में, लेना चाहिए नहीं लेना चाहिए? प्लीज. दूध को अमृत कहा है, बराबर है, हाँ या ना? आई एम नॉट एन एग्जामिनर यार, कम ऑन प्लीज. सर बरोबर के नहीं? घी को अमृत कहा है कि नहीं कहा है? दूध को अमृत कहा है कि नहीं कहा है? पर कौन सा दूध? करेक्ट. कौन सा गाय का दूध? करेक्ट. और चरक ने एक श्लोक लिखा है, कौन सा श्लोक बोलो? बष्कयिण्या त्रिदोषघ्नम तर्पणम बलकृतम च बालवत्स विवत्सानाम गवा दुग्धम विवर्जयेत. जो गाय का बच्चा 6 महीने से साल भर का हो गया है, बष्कयिण्या त्रिदोषघ्नम, वो ही गाय का दूध वात पित्त कफ कम करता है. तर्पणम बलकृतम च बालवत्स विवत्सानाम, जो गाय का बच्चा छोटा है, 6 महीने से छोटा है, 1 साल से छोटा है, या जो गाय का बच्चा मर गया है, वो गाय का दूध वर्ज करना चाहिए. क्यों भाई? जो गाय का दूध है गाय के बच्चे के लिए है, उसमें ग्रोथ हार्मोन्स, एस्ट्रोजन, प्रोजेस्टेरॉन, प्रोलैक्टिन भर भर के है. जो डेयरी वाले ठोकते वो तो अलग से. तो जब बच्चा 6 महीना साल भर का हो गया तो अपने आप वो हार्मोनल लेवल कम हो जाते हैं. वो दूध आपके लिए अच्छा है. मेरे गुरु, मेरे चरक, मेरे भाव प्रकाश, मेरे भाव मिश्र कभी गलत नहीं हो सकते. दूसरा क्या कहा उन्होंने? दिवाकर कर आघाताद अनल सेवनात व्यायामात सायंतनंतु वात श्रम हरम परम चक्षुषम. जो गाय दिन भर घूमती है, दिवाकर कर आघाताद, सूर्य का प्रकाश में घूमती है. कर के आघात, सूर्य का कर यानी किरण. दिन भर घूमती है, अच्छा चारा खाती है, पानी पीती है, वो गाय का दूध यदि आप शाम को निकालते हो, धारोष्ण गवा दुग्धम लघु उष्ण सुधा समम, वो गाय का दूध 45 मिनट के अंदर अगर आप पीते हो तो आपके लिए अमृत है. बाकी तो जहर है भाई. आपको और मुझे जो दूध मिल रहा है वो 1950 के बाद में कोल्ड चेन आपकी जब डेवलप हो गई है, फ्रिज की सिस्टम, उसके बाद में आपको दूध मिल रहा है जनाब. उसके पहले दूध कहाँ था भैया? आपके घर में गाय है तो आपको दूध मिलेगा. गाय को प्रेग्नेंट किस तरह से करते हैं? जबरदस्ती पकड़ के 3 साल की प्रेग्नेंट करते हैं, हर 11वें-12वें महीने में प्रेग्नेंट करते हैं. तो ये गाय का दूध और गाय का दही लैक्टोबैसिलस बढ़ा, कैसे बढ़ाएगा? ये बीमारियां बढ़ा रहा है. ओके, सो दैट इज ऑल्सो वन ऑफ द कॉजेस फॉर फैटी लीवर and also for the cancer. I know there are many questions. We will discuss about that. Otherwise, time will run out of my hands. So, non-pharmacological dietary interventions, low fat, mostly vegan diet, weight loss induced by exercise, calorie restriction, bariatric surgery, I leave it to your wisdom to be done or not to be done. And pharmacological statins, although statins are bad for liver, but you can use it judiciously if you are allowed to use. Thiazolidinone, GLP-1 agonist like liraglutide, Ozempic. Now we have intramuscular injection to be given. You see Karan Johar ka photo, उसने लिया है, and how he is looking. He is looking like an old man. Okay, GLP-1 agonist, a new drug for semaglutide. Yes, and metformin. Yes, metformin is again Galgia officinalis. Is a developed from the herb. Time tested drug. SGLT2 inhibitors like dapanom and all, and obeticholic acid, I don't know, but it can increase the blood pressure. Then ursodeoxylic acid, and as I am not expert in this, so I cannot comment whether you use it or not, that I leave it to you. So drug-induced hepatotoxicity, antibiotics, non-steroidal anti-infectious diseases, contraceptives, all these things, they can cause direct hepatotoxicity. Anti-tuberculous drug. There was a trial done and published in Journal of Gastroenterology 2008, and they did trial on curcumin and tinospora, and they proven that if this curcumin and tinospora is given along with anti-tuberculous drug, it prevents the liver injury. Even this example also I have given to Times of India, but I failed. Okay, so curcumin and tinospora, they are very good drugs for protecting liver. Direct hepatotoxicity, idiosyncratic hepatotoxicity, and indirect hepatotoxicity because of all these drugs. Treatment is anti-cytokine therapy and interleukin 2 therapy. So there are the immunity के arms है, T helper 1, T helper 17 and T helper 2. So T helper 2 gets stimulated and actually it causes inflammation. But T helper 2, this interleukin T also stimulates T regulatory cells, which reduces inflammation. So it is not our forte, let the specialist use it. I just said to complete the topic. The ABCs of viral hepatitis. Okay, so hepatitis A, B and C. You all are expert in that. I don't prescribe these drugs, so I am not a right person to comment. Probably doctor, he will be able to guide you more on these drugs, on anti-hepatitis drugs. Limitation of conventional treatment. Yes, there are a lot of side effects are there if you do not use it judiciously. So what else? What we can do if you have a patient of non-alcoholic liver disease or fatty liver disease? So what can we do? Okay, so Ayurvedic view, non-alcoholic fatty liver is a stage progressively called Yakrudodara. What is the meaning of Yakrudalyodara? Sanskrit Dalan टीका में यकृत दाल्योदर, यकृत यानी लिव्हर, दलन, दलन यानी मराठी मध्ये आपण दळणं म्हणतो की यकृत का आटा जैसा हो जाता है, उसका चूरा हो जाता है. So this is called यकृत दाल्योदर. Okay, cirrhosis of liver. The cells shrink, inflame and then shrink. So what are the causes of यकृत दाल्योदर or fatty liver disease? Again, diet, exercise and manasik. So can depression cause fatty liver disease? How many of you agree? All. Great. So these are the references. Rising rates of depression in India. Oh my God, मेरे Facebook को likes नहीं आया. Oh my God, मेरे Insta को likes नहीं आया. So girls are stressed out. They are doing suicide. If their Insta post and Facebook post are not liked, the way of tension. Okay. So this is depression, anxiety is increasing in India. 1 in 7 person in India is suffering from mental disorder. My God. This is ICMR study. This is fatty liver associated with depression? See, 10 studies involving 20,41,752 patients of non-alcoholic fatty liver disease. And they found this study demonstrated a high prevalence of depression in non-alcoholic fatty liver disease and significant association between both conditions. So both are, causing each other. Okay. Furthermore, the patients with NASH and significantly high risk of depression compared with those. So आपका liver अगर मजबूत है, दिल, हम बोलते हैं दिल मजबूत, दिल के साथ में अगर liver मजबूत है तो शायद आप स्ट्रेस से अच्छा सामना कर पाओ. ओके. आहार, निद्रा, ब्रह्मचर्य, ये हमारे 3 उपस्तंभ है. बराबर. नींद कम होने से भी फैटी लिवर होता है, ये तो हमको मालूम है. क्या दोपहर को सोने से फैटी लिवर होगा? आयुर्वेद में लिखा है ना, नहीं होना चाहिए, दोपहर को नहीं सोना चाहिए. सी, दिस इज द ट्रायल. हमारे डॉक्टर रामदीन है, उन्होंने मेरे को एक ही बात बोली, डॉक्टर नितिन, बाप दाखव नाही तर श्राद्ध कर. शो मी द एव्हिडन्स. त्याला उत्तर एकच, हा सूर्य आणि हा जयद्रथ. ये रिसर्च कहाँ पब्लिश हुआ है? वर्ल्ड जर्नल ऑफ हिपैटोलॉजी. Short sleep duration and long daytime naps are risk factors for non-alcoholic fatty liver disease. So these are the all evidences which have proven the ancient wisdom. gene expression, the effect of physical exercise. If you do exercise regularly, तो fatty liver नहीं होगा. Okay, it's a proven thing. So this is something: healthy liver, fatty liver, fibrosed, cirrhosis, and again cancer. So these are the stages. This is the right time to use proper intervention so that it doesn't go here. You can add some evidence-based drugs here so that it doesn't go here. If it is already gone, continue to. If required, take the help of modern science, continue your medicine and diet and everything. Okay, so that you can prevent this. और यहाँ पे पहुँच गया तो मेरे पास भेज देना पेशेंट को. Okay, so you are going to take now? You only, me only? Okay. So these are the advantages of herbal hepatoprotectives. Dr. Ashok Vaidya sir and Dr. Antarkar sir from Pune, from Podar. Anyone from Podar? Many are from Podar. So they have done a research on Arogya Vardhini, and they have proven that Arogya Vardhini, especially Kutki, is very good hepatoprotective. Then Phyllanthus niruri, Dr. Srinivasan, he is an MD pharmac. He has done research and he has proven that it is excellent for hepatitis B. So complementary conventional liver support, reduced. So these are the advantages. This is antioxidant, anti-inflammatory. This is the advantages of herbal medicines. Natural hepatoprotective, silymarin, curcumin, quercetin, that is punarnava. Andrographis. Andrographis is a queen of bitter herbs. सबसे कड़वी दवा कौन सी है तो कालमेघ. नीम से भी कड़वे. अल्कलॉइड्स किस में है तो कालमेघ में है. So this kalmeg is excellent for liver. Picrosites 1 and 2, Picrosia curua is from Kutki. That is excellent. Arjuna, again good for heart and liver. And alkaloids like berberine, okay, and mulethi. लेकिन मुलेठी वापरते वक्त एक ध्यान रखना, सी आयुर्वेद में जो गुणधर्म लिखे हैं ना वो होल हर्ब के लिखे हैं. हाँ, मुलेठी के लिखे हैं. मुलेठी एक्सट्रैक्ट के नहीं लिखे हैं. इफ यू यूज मुलेठी एक्सट्रैक्ट जिसके अंदर ग्लाइसिराइजिन ज़्यादा है, it will block the effect of beta blocker, and in fact it can increase the blood pressure also. When I was working in KM hospital, one patient of the epilepsy, and we always measure the therapeutic window of the allopathic drug, and I think sodium valproate था, एप्टॉइन में जो भी ड्रग है, and वो बच्चे का एप्टॉइन लेवल जो है वो कम ही आ रहा था. से फॉर एग्जांपल 13 to 14 होना चाहिए. And it was always coming low, but he was not having any kind of epilepsy. And suddenly, one fine day, he came in coma. क्या पता ही नहीं चला. नीलिमा क्षीरसागर, निर्मला रेगे, we all, and then we asked, we literally poked, कि क्या ले रहे बताओ. So the family revealed ultimately that he is taking one asav called शंखपुष्पी. हाँ, शंखपुष्पी रसायन और शंखपुष्पी आसव, okay, कि उससे कम होता है. So we evaluated that शंखपुष्पी and we found that yes, it has got anti-epileptic effect, but it blocks the effect of eptoin. So therapeutic जो window है उससे वो कम ही दिखा रहा था eptoin का. Now for few days the शंखपुष्पी syrup was over and he or she could not take it. तो शंखपुष्पी का असर निकल गया, तो blocking of effect निकल गया, eptoin का level suddenly बढ़ गया and he went into coma. So when it is not that always modern people criticize us, they are wrong. This kind of things, mistakes can happen. So be careful when you prescribe the drug. Extract अगर आप use कर रहे हो तो be careful. दारू हल्दी अगर इसका ज़्यादा strong extract आपने use किया तो it will cause severe constipation. Okay, so percentage कितना है? जब मैं टाटा हॉस्पिटल में काम कर रहा था on sarcoma, so Vithaferin A we developed 94%. Ashwagandha का Vithaferin A is anti-cancerous. And we were very happy. All sarcoma rat model they cured. Sarcoma is most difficult, and I thought, yes, I got something. After a few days, all rats died. That was because of the Vithaferin from Ashwagandha, and it was a first shock to my life. Then we reduced that Vithaferin A to 50%. So all rats survived, healthy person survived, and we started giving it to the sarcoma patient, of course with the consent. Out of 10, 7 patients develop hepatotoxicity. Again, अरे मेरे अश्वगंधा से साइड इफेक्ट हो ही नहीं सकता. कितना यूज कर चुके अश्वगंधा. That was not ashwagandha. That was ashwagandha enriched in vithaferin A 50%. So vithaferin A is very toxic. Many patients they develop pruritus, bad itching, which was not even going with any antihistamine. So slowly we tapered it off and we brought it down to 4% of vithaferin A. Now that 4.5% vithaferin A was tried successfully. Even in USA it has been tried. It is useful in glioblastoma and so many other cancers without having any adverse drug reaction. So whenever you are using extracts, be careful. Know how much percentage of berberine, how much percentage of vithaferin, how much percentage of glycyrrhizin or whether it is deglycyrized, tinosporin कितना है आप वो देख के करिए. I use भल्ला तक a lot, but बिलावेनॉल जो उसमें का एकदम जो टॉक्सिक मॉलिक्यूल है वो नलीफाई हो जाता है जब आप भिलावा को शुद्ध करते हैं, जो आयुर्वेदा मेथड है. तो भिलावेनॉल निकल गया तो साइड इफेक्ट होते नहीं है और पित्त प्रकृति में नहीं यूज करना है. सो दीज आर द थिंग्स विच यू ऑलवेज रिमेंबर व्हेन यू आर यूजिंग आयुर्वेदा हर्ब्स. ओके, होलिस्टिक पॉलीहर्बल सॉल्यूशन. So these are the principal ingredients. Pharmacological properties, hepatoprotective. These are the things. Normalizes SGOT, SGPT. These are the herbs, mode of action. Role of herbal remedies in liver protection. So cholerectic, picroside. So these are all things are available even on the net. You can read it. You can also ask for this presentation to DPN and all other representatives. They will provide you. Therapeutic indications, loss of appetite, alcohol-induced liver. So first you have diagnosed the case of fatty liver disease or alcoholic liver disease or any metabolic associated liver disease. Identify and use these herbs. If somebody is on anti-tuberculosis drug, talk to the treating physician, take his consent and provide them these herbs which are very safe. Now, I'm thankful to you all for listening to me, peacefully.
Good afternoon, everyone. Thanks for inviting me. I will let you go through the study which is done across 37 sites across India, and Pune was one of the sites. So we did around 1,000 patients. So it was done around 37 sites. Pune have 5 sites, even Mumbai have 5 sites. The study duration was August 2022 to July 2023. Okay. As already discussed, we all know even allopathic doctors using Lev 52, but unless until we have some robust data to show that it really works, then only there will be a validation and acceptance across the globe, not only India, across the globe. So that's why such kind of study is important, and thanks to Himalaya, which they are pioneer to do the study. So we'll take through the study. So what was the purpose of this study? To validating the safety and effectiveness, targeting a large patient pool and emphasizing the real world scenario. So the patient pool we have taken where we are commonly use Lev 52, only thing we did it through some study protocol. So study population, adult patients with history of mild to moderate hepatic disorder, screened almost 1531, through which almost 1,000 patients are enrolled. So what symptoms patients should have? Fatigue, nausea, anorexia, jaundice, muscle cramps, abdominal discomfort and pain. Inclusion criteria were alcoholic liver disease, where patient will have some persistent alcohol intake and LFT suggestive of liver disease. Metabolic associated fatty liver disease, where patient have impaired metabolic function. Drug induced liver injury, we excluded hepatitis B and C, and other viral hepatitis patients we have taken. Drugs, especially those have anti-tubercular drugs or antiretroviral drugs causing liver injury, such patients were taken into the study. So which patients we are excluded? Severe hepatic conditions and complications, undergoing some active treatment for alcohol withdrawal syndrome or chronic liver disease, and liver functions, liver enzymes were increased more than 5 times. So up to the 5 times you have taken the study, but someone having a severe liver injury where HGOT, HGPT more than 5 times the upper level of normal, such patients were excluded. So 1531 number of patients, of those enrolled were 1000. Some are discontinued around 38. So approximate 962 patients completed the study. So you can see ALD patients were 375, non-alcoholic fatty liver disease were 379, drug-induced hepatitis were 78, and hepatitis patients were 130. Some patients have NFLD plus diabetes also, where those were the 15 patients. So Lev 52 2 tablets twice daily for around 3 months we have given. So the aim was to safety evaluation. So monitoring adverse events using MEDRE, hematological parameters. It was done to see two things. One, symptomatic improvement, and another is lab parameters changes. So lab parameters like LFT, which is HGOT, HGPT, bilirubin, and alkaline phosphatase. There were clinical symptoms improvement where it was done checked for the quality of life. So registered real world study in herbal segment with large patient population, various hepatic studies. So it was multicentric. Adverse events were recorded, and biochemical and hematological assessments also done. Let's come to the safety. So of those almost 1000 patients evaluated, only few have minor symptoms. Only you can see the most common adverse effects were abdominal pain 2.6% and headache 1.7% were likely unrelated to the drugs, but hardly there are any side effects among the patients. 2 patients have abdominal pain and 1 patient some GI intolerance only among the 1000 patients. No impact on kidney functions noted. Now coming to the comprehensive safety evaluation. So number of cases clinically, 26 patients have abdominal pain, 17 were headache, alkaline phosphatase increase in 53%, bilirubin increase in 35 patients, and AST increase in 30 patients, and ALT increase 27%. These were all mild changes. Only adverse drug reaction where patient have some site of pain was 2 patients have mild abdominal pain and 1 have some GI intolerance. So now coming to the evaluation. So number of patients who have abnormal values at the baseline, you can see in overall patients. So SGOT 840, SGPT 729, bilirubin 347, and alkaline phosphatase 357. So patient-wise shift from abnormal to normal values in LFT, you can see the dark bar is showing the number of cases almost become normal. 592 in ALT, 244 in bilirubin, and 279 group in the alkaline phosphatase. Only these were remain have some LFT changes. Now coming to the ALD patients, these of the number of patients have some abnormal LFTs, and now if you see patient-wise shift from abnormal to normal at the end of the studies. So if you see AST, only 320 patients have some abnormal AST value, where 246 almost become normal, only 74 were there at the end of the study. Similarly, SGPT 212 patients were improved, bilirubin 114 and alkaline phosphatase 104 improved. So you can see a lot of changes happen at the end of the study. Coming to MFLD patients, these are the number of patients have deranged among the MFLD group, and you can see here at the end of the study 246, 244, 84 and 123. These were all recovered at the end of the study. Some patients have NFLD and diabetes both, where almost 15 patients. So you can see number of cases shift from abnormal to normal as 6 patients recover completely, 7 in ALT group, 3 bilirubin and 3 in alkaline phosphatase. So even those patients have MFLD and diabetes, those also you can see the improvement. Among the drug-induced hepatitis groups, at the end of the study, 49 in AST, 48 in ALT, 17 in bilirubin and 21 in ALP were almost completely improved at the end of the study in drug-induced hepatitis. So after 3 months giving those patients, almost 70% improvement you can see in drug-induced hepatitis group also. Coming to the viral hepatitis, at the end of the study, you can see 92, 88, 29, 31. Almost these number of patients are improved among the this. So almost you can see here, so almost 80% improvement in LFT viral hepatitis group. So overall impact, you can see the significant improvement SGOT, SGPT as well as bilirubin, ALP. So 70 to 80% improvement we can see at the end of the study in after 3 months. Now these were the clinical parameters. What were the clinical symptoms among those patients? So these are the symptoms we have taken. Patients with fatigue, tiredness, weakness at the baseline, patients with the nausea at baseline, patients with abdominal pain, and patients with muscle cramps. So most of the patients' clinical symptoms at baseline became symptom free at the end of the study. You can see symptom free cases at the end of the study. 49%, 73, 79%, 76%. So even not only lab wise, but even if you see the symptom wise, they are 70 to 80% cases they are relieved. Coming to the impact of on anorexia, total patients were 620, almost 485% relieved. So you can see 78% patients completely relieved of anorexia at the end of the study. So fatigue symptoms, there is an improvement in 49%, nausea relief 79%, abdominal pain reduction 76%, and muscle cramps improvement in the 71%. Quality of life, so change from the baseline in fatigue 40%, emotional fatigue 23%, abdominal symptoms 62%, liver activity 39%, worry 31%. There is some question here. There is a app where if you put this, you will get these things. So not only ALD group, metabolic fatty liver disease and drug-induced fatty liver and viral hepatitis. You can see 70-80% almost recovery in varied hepatic disorder. So quality of improvement, you can see abdominal symptoms 63% improvement, liver activity 43%, worry 21%, systemic symptoms 20%, and fatigue almost 47%. So overall 36% improvement. So clinical impact and hepatitis, we all know we are using it, but now through this study we could know this works on drug-induced hepatitis, including TB, antiretroviral drugs also. It having some anti-inflammatory, anti-oxidative and immunomodulating properties. Hepatitis protein effect in chronic non-infectious hepatitis also used. Hepatitis B and C we could not use because B and C have some different already drugs are there. But other viral hepatitis we could take into the study. So how it impacts, it works at cellular and metabolic level, membrane stabilization, it has effect, it improves intrahepatic cholestasis, and it has some antiviral activity. It shows where we have taken some conditions where patient having some viral infections also. So not only it having some anti-inflammatory, it has some antiviral properties also. So it's a real world scenario where it really works. It is effective and safe for various hepatic disorder. Almost 1,000 patients, only 2 patients have some adverse drug reaction noted, which is 2, and 1 patient have GI intolerance. Apart from it was tolerated well, and significant improvement were noted in the symptoms, liver enzymes, and quality of life after 12 weeks of treatment. So we all know it has some hepatoprotective effect. So these are the indications, like 4 conditions we have already taken. Loss of but if someone having loss of appetite, ALD, hepatitis, fatty liver, and drug-induced hepatitis, especially AKT-induced, where we can use this drug till the time we can withhold the AKT and we can give the supportive treatment. So thank you everyone, thank you.
Thank you so much, sir, for your insights on the trial. Moving forward, we would be felicitating both our speakers. So I would like to invite. So I would initially like to invite Mr. Ritesh Dixit ji, Zendra AGM. Please, sir, felicitate Dr. Kochar, sir. Further, I would like to request Mr. Aditya Vikram Kapre, sir, to felicitate our second speaker, Dr. Sachin, sir. Please, sir. Thank you. Thank you. Moving